Good morning, everyone. Here we go. This is John Dickerson, Primetime Morning with Richard Ruhling. Alright, there you go. Where we have Richard Ruhling, our guest for today's morning. By the way, I'd like to thank all the sponsors, to all the media outlets and organizations, to all our sponsors, to the CBS Entertainment Management, to our president, Amy Reisenbeck, and other people who's listening and watching our live telecast now. Give us a round of applause to one and only our guest for today's morning, Richard Ruhling. All right.
Thank you.
Richard. How's your morning?
Starting early with you. God bless you. Appreciate it.
All right. So, Richard Ruhling is a medical doctor. He is a published author. He's a CEO of health company. He's also a pastor. He's actually a brother in Christ. He is my brother in Christ, to let you know. And we are talking about his book, The Mega Quake. But before that, Richard Ruhling wanted to discuss about health, happiness, and destiny. We also have the website www.healthhappinessanddestiny.com. You may visit that website if you want to learn more about it. For now, let's start with a good discussion with Richard Ruhling about health, happiness, and destiny. Give it away. Go, Richard.
Okay, good to be with you, John. And here's just a few slides I have from a PowerPoint program that I think are instructive. And I'm going to try to move this. I can't quite read the thing without. I'm afraid to X that off. It might. Healthy habits can give us an extra 10 years of life, really, while medical care actually shortens life because prescription drugs bring problems. And at first, it seems like it relieves the symptom. But sooner or later you get toxic and you have two problems instead of one. And so I'm just saying that I'm board certified in internal medicine. I had a cardiology fellowship before teaching at Loma Linda University. And I'm qualified to say what I'm saying. My school was featured in this National Geographic cover story as the only blue zone for health and longevity in North America. And while teaching, National Institutes of Health gave my school $40 million to learn why the community lived about 7 years longer than other non-smoking groups. And I think it was because of the writings of the founder who wrote so accurately on nutrition and other topics. Actually, she was featured in a Time magazine thing where she got the President's Award for Uncanny Medical Insights. And it agrees with what Dr. Breslow at UCLA found a 10-year or 11-year advantage for people who had 7 health habits compared to people who only had 3 of the health habits. And here you see some of them like don't smoke, don't get fat, be active, eat breakfast, sleep, stay engaged, etc. That's Dr. Breslow. He lived into his 90s. And that's a good fellow. And here's the founder of Loma Linda, who was 100 years ahead of her time. This is from Time magazine. She was exactly 100 years ahead on tobacco. Surgeon General, 100 years later, discovered what she called a malignant poison caused malignant tumors. Very accurate in her description. And she wrote that pure air, sunlight, abstemiousness, which is abstaining from harmful things, moderation of things that are good, rest, exercise, proper diet, use of water, trust in divine power. These are the true remedies, she said. And this was before Breslow's study of cholesterol. He didn't really identify cholesterol as being a potential problem, but her treatment of foods went with, us avoiding foods that are high in cholesterol. And here's, this is 1990, U.S. News, How to Reverse Heart Disease. Actually, Dean Ornish, cardiology from California, got it from Pritikin, where I saw Pritikin at a cardiology meeting in mid-1970s. Pritikin was a genius, really. And his program did reverse heart disease, blood pressure, diabetes, and so on. In fact, this is a slide I saw at the medical meeting in Anaheim in the mid-70s. 85% are no longer on medication or drugs for blood pressure if they follow that diet. It was a 1-month program where they fed them and let them exercise. This one is about diabetes, and strict diets can get most adult onset diabetics off of their drugs or insulin. This was 23 patients who were taking oral agents no longer needed them, and 12 of the 17 who were taking insulin did not need it. And here's a book that I wrote some time back, and I'm saying medical care is not health care. It is the diagnosis and treatment of disease, and usually with drugs that are a leading cause of illness and death, basically because of toxic stuff. This is the physician's death reference. 3,500 pages of scientific medicine, and it's about adverse side effects, contraindications, why you shouldn't, drug interactions, carcinogenesis, which is about cancer, pregnancy warnings. Your doctor can't possibly remember them all. He's just practicing medicine, okay? He wants to see you again to be sure you're all right. That's why he says come back in a couple weeks or a month. And here's a classic statement given to me by a former head of the Department of Pharmacology. He had a PhD in pharmacology, was chairman of the department at Loma Linda, and here's a classic statement: the drug action always represents artificial interference with the natural functioning of the organism. In the widest sense of the word, every drug is by definition a poison. Pharmacology and toxicology are one, and the art of medicine is to use these poisons beneficially. Can you get that? Well, if your blood pressure is sky high, yeah, maybe you ought to. Yeah, take a drug and get it down before you have a stroke. But overall, even today, people tend to use poisons beneficially. Millions of people do this every day. It's with the brown liquids. Caffeine in coffee, tea, colas, most overlooked cause of medical problems really in the world, I would say. And I'll just give you a quick screen to take a look at this. Headaches, nervousness, and insomnia because it affects the brain and the nervous system. But caffeine turns the acid on in the stomach. You get indigestion, gastritis, ulcers, and GERD, gastroesophageal reflux disease. It increases blood pressure because your heart is beating faster. It can be irregular because it causes PVCs, that's ventricular contractions. I want to go back if I can. Yeah. My daughter got breast lumps working the night shift at the hospital. She was a registered nurse. But chromosomal damage can happen. Cleft palate, you see these little pictures of kids with a messed up mouth. They want money for surgery, donate. Well, mother took too much caffeine in the early trimester with coffee, etc. Osteoporosis for women. Cancer of the pancreas. In a leading journal, New England Journal of Medicine, in 1981, reported a high association with coffee. Not smoking, not drinking or other things, but coffee and bladder cancer. Elevated blood sugar and triglycerides, and the Russian scientists called it bad habit glue. It glues our bad habits together. So anyway, well, that's maybe enough for that right now. If we, I don't know how many minutes I covered, but I just say, Bible has a warning, and in Revelation 18, verse 23, nations are deceived by sorcery, but the translation really comes from the Greek word pharmakia. Pharmakia is deceiving the nations. And I don't know why they translated sorcery, except maybe it seems like black magic to take a pill and get your symptoms gone. We could there's lots more to share, but I don't want to overrun my 10 minutes. Don't know where I'm at. Thank you, John, for this opportunity.
All right then, perfectly said, Richard Ruhling. By the way, here we go. One of our viewers here from ANC, because he's actually one of the anchors of ANC, Mike Novello. He just recently visited your website, Richard, and he wanted to ask you a question now. Right?
Sure. Go ahead.
It was actually clearly stated in the website, almost anyone can add an extra 10 years to their life. Now, if Mike Novello, wanted to add 10 years of his life from now, what he should do to add another 10 years of his life? Go on, Richard.
First of all, I want to just underscore that yes, it's possible, even late in life, if at whatever point we make a big change, the body forgives us for its abuses and starts, like, your cholesterol will start reversing itself. It's not fast. If you get the flu, you get over it quick. If you get cholesterol, it takes a while for the deposits to remove, but they do, okay? And as part of my seminar, I show a video from Dr. Esselstyn of the Cleveland Clinic, and ragged artery after a heart attack, but months later, smooth artery as the body has mended the damage. And it really would be a low-fat, low-cholesterol diet, because oils, fats, even vegetable oil, we think, oh, that's fine, it's healthy, but really it makes the blood sticky. So your blood pressure tends to go up when your blood is sticky with a high fat, just like with alcohol. Alcohol makes the blood sticky too, so it makes your blood pressure go up, etc. So, but Pritikin, if you could get a hold of Pritikin's book, I'm not in favor of the spices he used because the diet is kind of bland or drab, and so Pritikin puts spices, but that's bad for the stomach. You know, heart. To help your heart, you don't have to add spices to the food, you know. And I've learned that, you know, you can, a salad, for instance, without the dressing, you can throw some beans or peas or brewer's yeast or slice of tomato. My wife uses sometimes raisins or apple diced in there, whatever. It's still interesting and good, and you don't have to have 1 tablespoon of salad dressing is a tablespoon of oil, roughly, and it has about 12 to 14 ears of corn in it. You wouldn't think it would take that many ears of corn to make a tablespoon of oil, but yes, it is. And it's a form of overeating, basically. So that's just in a nutshell.
Oh, wow. Perfectly said. All right. Hear that, Mike? Coming from Richard. All right. So, also Richard, okay, they wanted to ask you, this is coming from also an ANC anchor. Her name is Nikki de Guzman, okay? Say hi to her.
Hi, welcome. Glad for questions. Go ahead.
Okay, so given that we have this COVID pandemic, all right, in the past how many years now, she wanted to know, since you are a medical doctor, where did COVID virus started?
Number one, I'm not even sure it's a virus. They can't isolate the virus to make the usual type of vaccine like you do for mumps or measles or something like that. And so they engineered something with mRNA, but I think it messes up the immune system, to be honest with you. In fact, let me give you a quote from a cardiology journal. This is Circulation, published by the American Heart Association for cardiologists. And this is the quote. I've memorized it. We conclude that the mRNA vaccine dramatically increases the inflammation on the endothelium. That's the lining of the blood vessels. And T-cell infiltration of cardiac muscle in your heart, resulting in thrombosis, which is blood clots, cardiomyopathy, which is heart failure, and other vascular events following vaccination. And so when you see these young people dropping dead, athletes on the field, basketball, etc., 18 and 21, or the NBC or ABC, I can't remember who, executive producer, 37 years of age with kids, drop dead. Why? Because this company mandated the shot, okay? And we don't know who's going to die. It's like adverse reactions to pills and drugs. Actually, I had an interesting experience with my wife who had a bladder infection. This was 13 years ago. And she went to her doctor. I was retired at that point. Took a Cipro, which is an antibiotic that I've prescribed, but it's not my favorite. And cured her. In 3 days, she didn't need the pill anymore. Okay, she took it as prescribed. But months later, she had a rash under her skin. She went to her doctor, did a blood test, called urgently the next morning, saying she has no platelets in her blood. See the hematologist she's referring. He put her in the hospital, did a bone marrow, no platelets in the bone marrow, took her spleen out, still no help. Transfusions, in and out of hospitals, died of a stroke. I'm remarried, happily so, in Arizona now from the D.C. area. But I'm just telling you, prescription drugs are the most dangerous thing you can put in your mouth. And I went through U.S. Senate with medical literature showing this, that it's a leading cause of death.
9/11 was big and they stopped the planes. Well, they're not stopping the prescriptions, okay? They like what they get from pharma. One senator said, I'm wasting my time. They own us. Speaking of donations that the drug companies make to their reelection. So, bad situation in this country. They're not true to their oath of office. We should not allow them to get perks and all the blessings from the drug companies. They should report it straight out. Anyway, thank you.
Wow. Perfectly said, Richard. Awesome. Okay, so alright, this is going to be the very last question, alright, from one of our attendees here, Richard. Coming from the director, the Technology Solutions Director of YouTube, okay, you're familiar, and we are very familiar of YouTube. By the way, I just want to thank all the media outlets and press right now on watching the live telecast with Richard Ruhling. By the way, Mike Drake, the director, all right, from YouTube Technology Solutions Divisions, he's been with YouTube in November of 2015. So it's been how many years now? I wanted to ask you, Richard, okay, um, being a published author, being a doctor at the same time, what are your other profession as Richard Ruhling?
Well, my greatest interest really is since retirement. Since retirement, I went to a Bible prophecy conference 35 years ago, and really interested me because I learned at that point information that enabled me to predict the war with Iraq before 9/11. We all know on 9/11 we started blaming Iraq and so on, got into war, but the Bible is actually a chapter that Christ identified when he was asked about the end of the world. He said to study and read the book of Daniel. And Daniel 8th chapter has a conflict between a ram and a goat. I actually have a picture here. I don't know if you can see it or not, but a goat comes flying from the west to stop a militant Muslim ram and to break its horns. The horns are said to be the kings of Media and Persia, but those areas are now Iraq and Iran. Persia is Iran, okay, etc. So, and I'm confident that the next war we have is not with Russia, not with China or North Korea, as Obama was worried about, but it will be with Iran. And I believe we're going to get there soon. In fact, well, it's in the news. This is there. You can see it. Maybe 57 Muslim nations have been urged to siege Jerusalem or Israel. Okay. And I believe it's this spring. And if we see it, look out, because we're headed for serious troubles in this country. I believe when the Muslims celebrate their mosque, which has an inscription, Allah has no son, we will see an earthquake, megaquake 2023 in May, okay? And that's, but more information later. I didn't mean to sidetrack, but I love to share what I think is on the cutting edge of stuff, and thank you for the opportunity with the question.
All right.
Go ahead.
Okay, perfectly said, Richard. All right. By the way, to all of our viewers now, okay, can you tell us where people can contact you and buy your books and other articles related to you, Richard?
Yes, Amazon has them both and digital Kindle. Cheap is not expensive. I'm not trying to make money. I'm just trying to get a message out. And so go to Amazon, select books, type in my name as the author, Richard, and the last name is Ruhling, spelled with an H. It's Ruhling, as you see here. And you can look at whatever you want, but I have a variety of books. This is one of the latest and most insightful concerning what's going to impact us, because really the San Andreas is 80 years overdue, they say. And they don't know when, they just see it's going to come. A scientist can't help us much, but I think the Bible, God wants to give a warning, and we've got enough warning signs, but that's just it in a nutshell, where they can find it. And if they want to talk to me, if they got questions, this is for media, I would say email me, and my last name, Ruhling, Ruhling 7, the number 7, at either yahoo.com or juno.com. Juno is my primary, juno.com. That's Ruhling7 at juno.com. I'd be glad to try to answer. And if it's easier to talk, I'll give you my phone number at that point too. But well, I'll give it now: 928-583-7543. So if you want to reach me, I'd love to work with you somehow. Thank you.
Okay. Wow. Thank you so much, Richard. Okay. So guys, we will be back after 5 minutes. Let's have some break. Thank you. Thank you, Richard.
Thank you.